This episode was pre-recorded as part of a live continuing education webinar. On-demand CEUs are still available for this presentation through All CEUs. Register at allceus.com/counselor toolbox. Okay, so I'd like to welcome everybody to today's presentation on medication-assisted therapies for addiction. And if you are a mental health counselor, you don't typically work with people who are in active addiction. That's cool. If you are working with someone who is in recovery from addiction or on medication-assisted therapies, it's helpful to know what meds they might be on and how that might be impacting their mood, as well as some of the contraindications you might want to be aware of, so you know when your patient is getting into a position where they might be in jeopardy of harming themselves. We're going to discuss the purpose of long-term pharmacotherapy. And when we talk about long-term, it's not necessarily forever and always, but we're really looking at several years as opposed to 6 months. We'll identify pharmacotherapies for smoking, alcohol, and opioids for the most part. We're also going to talk about some of those other drugs that don't have medication-assisted therapies identified for them. So why do we use them? In early recovery, we want to help people reduce cravings when possible. And medication-assisted therapies that are so labeled are designed to assist patients in not having as many cravings. So the medication-assisted therapies can help reduce their desire, their compulsion, their obsession to go back out and use in order to feel that feeling again. It provides increased self-efficacy and a greater sense of control when clients can go in and say, all right, I'm taking this, it's going to help me not have cravings. Well, we know part of it's going to be placebo effect. That's okay. I don't care where the effect's coming from. If it's a positive effect, I'm pretty darn happy.